From as far back as I can remember, I always had a tremendous need to help people. Always had a love for medicine, and I always had a special thing for feet. When I was a little girl, my uncle, who was 50 years old, had a stroke and became a paraplegic, and when I used to go visit him, I used to cut his toenails. I had always taken care of my grandfather, who lived with us and developed gangrene, and he had amputations. I was always there to care for him as a child. We are actually going to make a surgical fracture on the first metatarsal and move the head of the first metatarsal over and put a little screw in to hold it in place, remodel it, and straighten her out. Anything that's related to the foot and ankle, I'm there to treat. A patient can come into my office and have their toenails clipped. The next patient could come in with the total deformity of the foot with hammer toes, bunions, and I could be in the operating room restructuring their entire foot. And believe me, nobody's leaving the operating room without a perfect foot.
In the surgeries that I do, I use intraoperative fluoroscopy, which allows me to visualize the bones of the foot while I'm performing my surgery, so it's impossible to make any error. She has a lot of pain in the fourth toe. She's got an enlarged bone, and this is what it looks like pre-op. Now I'm going to go in and fix it.
The problems I was having with my foot basically limited me with everything I was doing. So it got to the point where it was very aggravating, and I finally had to do something. I'm glad I finally made the decision to see Dr. Hagen. My recovery has been terrific. I'm very satisfied with where I'm at right now, and there would never be a reason for me to go anywhere else.
I'm going to take you shopping. After the feet heal, we go shopping together, okay? Just call my office and I'll pick you up.
I built my practice on a personal level. I feel a tremendous passion for my patients, and I love the interaction. I look at my schedule when I first come in the morning and I say, oh, I'm excited to see this one, I'm excited to see that one. It's more than just a medical encounter.
We got to get you back in those gorgeous Louboutin shoes, high heel Louboutins, okay?
She's very caring, very thoughtful. When I had surgery, I had it done on a Saturday. She came in especially to do it for me because I work Monday through Friday. She called me on Sunday to see how I was, to see how I was doing. That's what Dr. Hagen is.
She's not just a physician, she takes care of you as if you're family, and she's very good at what she does.
Not only do I love my patients, I also feel I'm very highly trained in my profession. This is a treatment that I use, and not that many doctors are using it. It's called PRP, or platelet-rich plasma. We draw approximately 10 cc's of blood. That blood is spun for approximately 5 minutes to separate the platelets and white blood cells, which are the healing factors. Once the blood is spun down for 5 minutes, the injection of the platelets and white blood cells that are separated from this machine is then injected sterilely. So basically you're taking the healing factors out of the patient's blood and injecting the healing factors to induce healing. My office is equipped with all the latest laser equipment, all the latest technology that you need. This is a laser that's used for nail fungus, and it's as simple as this. The patient just sits, they can read a magazine, listen to their iPod, and in 15 minutes or less, they're out of the office. When patients leave my office, I want them to tell their friends and family that they met a wonderful podiatrist that really helped them, and that they walked into the office in pain and they walked out without pain, and they met a person who was very different than anybody else they ever met. Very dynamic and very personable, and a person that had a lot of compassion. The care is wonderful, the follow-up is wonderful, and the treatment is wonderful.